Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Ever wondered, what is normal labor and why is it so important? Normal labor, a physiological process that leads to childbirth, is a critical phase in every mother's journey. It's a remarkable event that signifies the end of pregnancy and the beginning of a new life. The significance of normal labor extends beyond childbirth. It plays a crucial role in the health and well-being of both the mother and the newborn. Now that we know what normal labor is, it's time to delve deeper into its stages. The first stage of labor, also known as the latent phase, is all about contractions. It's the time when your body starts preparing for the delivery of your baby. These contractions are your body's natural way of dilating the cervix, which needs to open up to about 10 centimeters for childbirth. During this stage, contractions might start off mild and irregular, but they become more regular and stronger as labor progresses. Think of it as your body's rhythm, gearing up for the big event. It's not uncommon to experience a myriad of emotions during this stage, from excitement to apprehension. You may also feel a bit of discomfort, which is perfectly normal. But remember, each contraction brings you one step closer to meeting your little one. As the cervix dilates and contractions become more intense, we transition from the latent phase to the active phase. With the completion of the first stage, we move on to the active phase of labor. The second stage of labor marks the active phase, and it's when things start to get intense. This stage commences when the cervix is fully dilated, opening a pathway for the baby to travel from the uterus through the birth canal. As the baby moves down, the mother may feel a strong urge to push, which is a natural response to the pressure of the baby's head. It's a time of intense focus and effort. Now, the birth of the baby happens in this stage. With each contraction, the mother pushes, and with each push, the baby moves closer to its first breath outside the womb. It's a dance between mother and baby, each working together to bring about this miraculous event. But remember, once the baby is born, the labor process is not over yet. We still have the third and final stage. So keep breathing, keep pushing, and keep going. The journey isn't over just yet. The third stage of labor, although often overlooked, plays a crucial role in the childbirth process. This stage, which is often less discussed, involves the expulsion of the placenta and the final contractions. Let's dive a little deeper. Once the baby has been delivered, the work is not yet over for the birthing person. The uterus continues to contract, this time to help separate the placenta from the uterine wall. These contractions are less intense than those experienced during childbirth, but they are still noticeable. The placenta, which has been the baby's lifeline throughout pregnancy, is then expelled from the body. This is usually achieved within 5 to 30 minutes after the baby's birth. This expulsion is a critical part of the process, as it helps to reduce the risk of postpartum hemorrhage, a leading cause of maternal mortality worldwide. In summary, the third stage of labor is a vital part of the childbirth process, ensuring the health and well-being of the birthing person. With the expulsion of the placenta, the labor process is officially complete. So what have we learned about normal labor? Let's recap. Normal labor is a natural and intricate process divided into 3 crucial stages. Each stage plays a distinct role in the journey of childbirth, and understanding them can help us appreciate this incredible feat of nature. The first stage of labor, the longest stage, is all about the cervix. It's a time of gradual dilation and effacement, leading to the magic number of 10 centimeters. This dilation allows the baby to move from the uterus into the birth canal. It's a time of anticipation and patience. Transitioning into the second stage, we're talking about the active part of labor. This is where the real work happens, with contractions intensifying and the mother pushing to help the baby descend. It's a test of strength and endurance, culminating in the most beautiful moment, the birth of the baby. Lastly, the third stage of labor, often overlooked but equally significant. This stage involves the delivery of the placenta, an organ that has been the baby's lifeline for the past 9 months. It's a time of recovery and relief. Remember, while labor can be unpredictable and varies from woman to woman, these stages provide a general framework. Understanding normal labor not only demystifies the childbirth process, but also empowers mothers-to-be and healthcare professionals alike .umcc, your ultimate medical consultants connector.